Good afternoon, everybody. So this is one of our last sessions, so hopefully we'll have some fun. We're going to share some thoughts and ideas and so forth. This has been really quite the journey, so I hope you pull out of it a couple things with regards to where we were, where we are, where we're going, and then the lessons learned. So when I started, most of our philanthropy was restricted. And people were giving to, we want certain things for this program and certain things for this program, and you all know that doesn't necessarily work too well, because you can be the jack of all trades, master of none. But since then, we've gone from almost all restricted to all unrestricted. We're going to talk about the journey how we got there. Second, I think most importantly, was about finding a leader who could really be passionate about leading the philanthropic efforts. So I just want to tell you a quick story. I'm a man of stories, and this is Patty Holman, our senior leader for philanthropy. Patty came from Ireland, and Patty, say hello to everybody today.
Hello.
Say that in Irish. How would you say that? Okay, here we go. So now, who could reject that voice, right? So what I want to share with you, because as a leader, as a CEO, you're always pivoting and thinking and how you can get acceptance and buy-in and so forth. I've been at Plymouth Place now going on my 6 years, so when I first started, I thought, man, we really got to do something philanthropically. And, you know, the short of it is, as I talked about some of the things we were kind of struggling with, philanthropic was one of them. I had a group of older women, lovely ladies, seniors, who had their certain specific ideas about what philanthropy should be. Do you have a group like that? Okay, you probably do. And I thought, how am I going to, and I had met Patty, actually I met his wife before they were even married, and I knew Patty was someone who could really, really help us, especially after I met him. In 20 minutes I said, you know, this guy could convince a lot of people about a lot of things because it's about heart and passion. Well, when I had him come and interview, because I wanted buy-in from, there were, I think, 9 or 8 ladies who were in this group. He came in and he started interviewing, and I can tell, I started sweating because they just weren't buying this Irish thing. They weren't buying the strategy. And I thought, oh, gosh, what are we going to do? Because I think he's the guy for us, and we need to get buy-in from these residents. So he stepped out of the room, and I talked to each of them. I said, well, what do you think? We're not sure, and I don't know, I'm not sure if he has the right strategy. We're just, okay. Yeah. So I walked out and I said, Patty, I'm going to have you come back in and just be ready. He said, oh, okay. So he came back and I said, we're going to finish this interview, and Patty is going to sing an Irish lullaby. He's going to sing for you. And what was the song you sang?
Molly Malone.
Molly Malone. Okay? He stepped out of the room. At the end of that, everybody says, oh my God, he's fantastic. Yes, we need to bring him in as our philanthropic leader. But what it was just trying to understand, you know, who he was. And again, I share this story, it's a little funny, because there's lots of opinions about what we should be or where we're going and so forth. But Patty, why don't you get us going and talk to us about the journey, and we have a potpourri things here for you.
Is he going to sing?
Yes, we are. He will at the end. Yes. We go, and I'll talk about that.
Microphone is on.
We're just curious now.
Hi everyone. And yeah, I'm delighted to be here. Patty Holman, as I said, as Jay said, is my name. And I'm here in America now 15 years, would you believe it? I'm just going to put this down here. So, yeah, when Jay called me a couple of months ago and said, you know, Patty, I think you'd be great to come to Chisholm. And I had known of Chisholm for quite some time. And I was like, great. But then I was thinking, at the back of my mind, I'm thinking, oh, there's a lot of Irish music on March. Am I going to do it? I said, okay, I got to do it. But the CEO tells you got to go, you turn up, you know, particularly Jay Berry. But it's very interesting, though, last night to be part of yesterday evening and to see the keynote address and to see that young child playing. He's such a phenomenal singer. And he had a story too, and I think everything that we're talking about here today is just all about stories, meaning making, trying to understand the sense of journey that we're all on here. And I suppose, you know, my journey, just to give you a brief outline of myself, I came to America by really by accident. I came here first in 2001. I was supposed to go back in my life. I'm the only one in my family to go to college. 7 of us in my family. I come from the north side of Cork City, where 3% of my parish actually end up going to college. And the rest of my family are far more intelligent, I can tell you. But I had the opportunity, and I saw education as a great gift. And I've been singing for as long as I can remember. In fact, my mother has said that I've been singing longer than I've been walking. But I learned early in life that music for me was perhaps an escape. In fact, I had a very bad stutter when I was about 8 to 12 years of age. It comes back every now and then. But I knew when I sang, I never stuttered. I just kept singing. It's fascinating. And I came out to America, and I must say, I had a kind of a rough childhood. My mother basically reared us on her own. And, I see everything that we do here, everything that Chisholm is about, particularly last night, it's a true ministry. It's a real calling. It's like, why are you here? Why did Jay Berry ask me to be here? And why am I here? So I look at it like as fate. I was meant to be here today to tell this story, which we are so proud to talk through. So everything that I'm going to talk about here today, we all have a different story. It comes back to values, the types of values. If your values align with the institution that you're representing, do what you do with a passion, and great things will follow. My first job when I came here, I managed a home care company for 4 years. And I remember one time, I was looking after this guy. We did a great job. And our accountant at the time said, she didn't mean anything by it. She said, okay, I'm going, make sure nothing happens Friday this weekend. I said, what? Make sure nothing happens Friday. I didn't register. Well, I suddenly realized we were billing by the hour. It was a different model of care. We were billing by the hour. For profit, it was to keep the hours at a median level. And I suddenly said to myself, I just don't think this fits for me. So I ended up working for the Lutherans, the Lutheran Life Communities, phenomenal organization. And I remember one time I was with the Pastor Matt, in Chicago, and I was in St. John's Chapel in Arlington Heights. And of course, this time I had my purple tie on. This is my green tie, as it's March. And I got this tie 5 years ago, yesterday, as a gift because I got my citizenship as a United States citizen. So I happened to have it. I was very proud of it. And this one guy said to me, he says, oh my God, he said, in St. John's Chapel, he said, I never realized there were so many Lutherans in Ireland. And I said, absolutely, we're making a comeback. And I was searching for, a new place to build out that sense of compassion, and I found Plymouth Place. And I've been here now for 4 years. Jay's been here for 6. We wanted to start from the point of COVID, because I think that was a crystallizing moment for everyone's life. And just, we're talking about navigating the mountains and valleys. We'll get to that later. The highs and the lows of philanthropy. And where do we all fit into that? Really, for mountains, it's the highs, we're telling our story. For the lows, we see the opportunity, we get involved there. There's a lot of hand-holding in everything that we do. So this is what I started from. I was thinking not-for-profits, having proved themselves as leaders in their community during the COVID-19 pandemic, can continue to lead in transforming the age-old paradigms that exist in our society, in partnership with donors and their families. Those age-old paradigms we'll get to later. In my opinion, we tend to live in an ageist society, one that has so many categories in life. And particularly as you age, you're pigeonholed into a corner, and God forbid if you get a dementia, then you're really out there. So you'll hear this type of vision that we're taking people on a journey and the role of philanthropy within this. My background was in social work, particularly gerontological. I did child welfare in Ireland, came out here, then I've always worked with seniors since. I did go back to DePaul University in 2010, and I did a master's in philanthropy. integrating my love of service for seniors with my love of music, integrating music into fundraising for non-profits. And only in America, I managed to write a PBS documentary, a self-made documentary, and it got published in 2020. It's going to be out for St. Patrick's Day, probably around your local PBS. So watch out for that. I write that because, you know, what's my story? You have to know your own story, know your own values when you're working with your organization. When you're on the front line working with donors, everything has to align. You have to really believe in the mission. This was perhaps one of our iconic pictures of 2019. We celebrated our 75th anniversary of Plymouth Place. Plymouth Place is in LaGrange, Illinois, and when we came in, there was a furor of just great excitement. Wow, 75 years, we were working it through. Jay had explained to me at the time, we've great opportunities to maybe sometime build a new campus, but for now we've got to get things, you know, organized. And of course, when you first arrive, you're just trying to manage everything. But to go back in our history, we were founded on D-Day, 1944, by 50 area churches, including UCC. In fact, one of the churches that I was part of before, and still have a great association with, is St. Paul's Church in Chicago. And they were part of the original founders as well, mainly Congregationalists. We're a life plan community. The common denominator for me is that I have to work in an organization that will never ask a resident to leave. I truly believe that based on my own experiences. Once you're in, we will go to the very ends to make sure that you're part of our community, your family. That is a powerful, compelling statement for any donor. We're governed by a 16-member board of directors. Very interesting, in partnership with a very robust resident council at Plymouth Place. They know how to have a resident council meeting. Wow, and this is the man to shepherd them through. It's pretty incredible. And of course, you know, we would not be as successful in philanthropy at the moment if it wasn't for a very strong CEO who has that vision to pull everyone with them. And that's what philanthropy is all about. Philanthropy is that, you know, it's all about linkage, making these connections, telling our story, and hand-holding people and telling it over and over again, and being very careful on who we spend our time with, and we will get to that in a minute. Our mission areas, we have an employee scholarship program that was set up in 2016. It's interesting, since 2020, when we were in the height of, you know, everything that was going on, we've given away close to $283,000 in scholarships. Is there another senior living community out there that's able to do that? I hope there is. But we are doing it, and we're so proud of that. Our residents give to scholarships. And the backdrop behind that is that that wasn't something that we came up with. Because when you look at plan giving in particular, we're all about sowing the seeds that will reap the benefit many years down the line, perhaps even after we're gone. And this particular gift that came through from to create our scholarship program was from a lady called Elvira Teufer. Absolutely great person. I never met her, but I've read of her. And she had no kids. Always came down to our reception at Plymouth Place. Said hello to the concierge staff. We were doing a story on her last year. I rang up her friend in Chicago and I said, tell me about her. She says, tell me about her. We offered her to go on a world cruise at one time and she says, no, it's too expensive. She never wanted to spend the money. But yet when she passed away, she left an estate gift of close to $650,000. That allowed us to instigate the scholarship fund. I kind of look back on those types of donors and say, who were they? What were their values? What did they see in the frontline staff that made them think that their values aligned with theirs? There was a matching of values. they made that gift. They made that gift. Look at the impact that one planned gift is having when we're able to send probably about 120 people through scholarships to this day. And more people have given because of that. You know, good begets good. We have two chaplains that, what's the difference between us and a for-profit? Probably we're a life plan community and we have two chaplains. We're not here to ram religion down anyone's throats, but we're an organization that's very proud of our Christian values. It's a wonderful approach to care. One chaplain, Chaplain Doreen, she is working with all of our skilled assisted living, and Chaplain Christina here, who's actually going on to do her doctorate. Christina is United Methodist, Chaplain Doreen is Presbyterian, and I'm actually traditionally Irish Catholic, but I lead the service with the chaplains on a Monday. Isn't that great? That's what it means to live in a diverse community. And may I say, welcome to Chicago, because that, you know, that just for me symbolizes so much. So that's a giving area as well there. We also work with donors for special projects. You'll see on the left here, this is the Carhart Garden on our skill floor. So we work with donors. We always have to work within the teams to know where the budget is. Where's the need? Can we get donors to make a gift to impact the budget? That's the number one. Got to get to know their passions. In this case, we transformed this particular garden because we realized during COVID that so many people wanted to bring their mum and dad, who were in isolation on the third floor, to an area on the third floor that was open to families. So we really made a phenomenal job of that. It cost something like $250,000. We were able to more or less fully fund that. And then, of course, you know, the age-old image of Plymouth. I know the lady down there said, "Is Plymouth a for-profit?" Well, we may look like a for-profit, but we're a not-for-profit. And I think that's the big challenge for donors, including some of our board members, that say, you know, why should I give to Plymouth? They kind of have everything. We've been trying to walk that back, to tell our story, to see how we're making an impact day in, day out. One conversation at a time, one personal note at a time, one birthday card at a time. It does come back to face-to-face meetings as much as you can in a purposeful way. This picture here on the right, we featured this last year where Jay was, we have an association with area not-for-profits. Jay, I'll hand it over to you if you want to say a few words about that.
Yeah, so if you look at our social accountability, we give back to about 20, 21 nonprofits in the area. They use our space. And then with benevolence, we give back about $500,000 a year. It's very significant. And these 20 or 21 nonprofits do lots of different things, and not just senior living. We had formed an informal co-op during the COVID period. And last summer, unfortunately, one of these microcell storms came through and knocked our power out. And it also knocked the power out of Cantata. I got a call at 3 in the morning with regards to our very difficult situation, but we kind of worked through it. Unfortunately, Cantata, which is called the British Home, did not. And they were out with no power whatsoever, no elevators whatsoever, and really in harm's way within about 24 hours. Got the call from the CEO and he said, "Can you help me out? You know, I need to house about 50 residents." I said, "Well, I've got a little extra room, but I can house maybe about 10 or 11. We got thinking there's got to be a way we can do this. Without going into the story because of time, believe it or not, we got a hold of the Homeland Security, who has a big warehouse next to us. We said, "What do you got?" He said, "Well, we got cots." "Really? You got cots?" "We could use cots." So we set up 40 cots to house those who are memory care and assisted living. And by the time they got to our community, they were disheveled, they were dehydrated. The temperature was probably, because there was no air conditioning in the building in their community, but they were really, really in harm's way. So it's just one of those things that we try to do. And you say, well, what does that have to do with philanthropy? It's not always what we're getting, but it's what we're giving, and it's part of the story. So this was a really iconic story that moved our residents in a really great way. You might know Cantata, they're mainly a needs-based rental community, and of course we're something totally different. So that's an iconic picture about what we need to do. And again, so shall you reap. And it's a real important principle associated with philanthropy.
And of course, we actually got quite a few gifts that came in from people that, thanks Tom here, experience. Many people gave gifts just based on that. We wrote a story around that, like, oh my God, we can't believe that you opened your arms. And we said, well, of course, this is what we were established for. This is such a way, I'm being genuine and saying, or we're like a community without walls, if that's the right way to say it, because we're so invested in making a community impact, and not just looking after our residents, but also looking after our staff. So this is our traditional donor wall. So how many here work full-time in philanthropy? Is there anyone works? Okay, yeah. So I work really, there's one of me, I have one person below me. We do the annual fund, major gifts, planned giving, everything wrapped into one. When I arrived, this was our wall, beautiful wall. It's based on a giving tree, as you can see the root here. And if somebody came along to me first day and actually had quite a few people and said, I've been looking for my name on the wall, can you tell me? I'm like, I'll have to get back to you on that, you know. But we had one particular incident, and the whole setup of this at the time was that somebody, if you gave $1,000 cumulatively, you got your name, you got a little leaf on the top. That sounded good, but then a lot of people forgot to give. If you give 1,000 over your lifetime, that's you know, maybe not much. So we had a lady that had passed away one time, and when we had reached out to the family, there was very few notes on it, and the family had said, "Wow, she was on the wall. She gave a lot of money to Plymouth." Well, she did give a lot of money. She gave $1,173 in her lifetime, but she left over $16 million to another foundation. And we said, okay, wonderful. We honor that person. That a gift is a gift. We've got to be very thankful of that. So we decided to reimagine and create, go back to the traditional form of donor societies, you know, and everything that we do is based around our donor societies. Those that give annually, those that give loyally, and it's all about getting people, keeping our closest donors closest to us, finding new ones, and bringing them through that continuum with our senior leadership team, with all of our staff. And really this has to be a calling. This is not a job, you know? And we have to train that to all of our staff. Why are you here? Because we must understand that your actions has many different ripple effects, and it does come back to have an impact on philanthropy. So just having everyone on that philanthropy framework of mind is crucial. Where were you on March 11, 2020? Who knows when that date was? Okay. Jay?
Yes, well, this was a St. Patrick's Day event, and there we were, and of course the next day the entire world changed. And as we kind of maneuver through the next couple slides, you know, and I'm sure a lot of you did this, you know, how are you going to make, you know, lemonade out of lemons? And so in many ways it was kind of interesting. As much as COVID was a curse, it was a blessing on the opposite side of it, if you will, because it fast-forwarded things we need to be doing, thinking about, strategizing. It fast-forwarded, you know, thoughts with regards to technology, you know, things we need to kind of think through, if you will. Matter of fact, if you kind of move to the next slide, this is one of our residents, by the way, who this year, okay, this is Marion Giles. You know how old she's going to be this year? 107.
Wow.
She's been at the community for 32 years, and in our Monarch magazine, which Patty brought with him, she's our, we call her, and I said, Marion, I hope this covers the DEI principles. You're our cover girl. So she's on the front copy. But it was kind of interesting, just again, a very small story for the sake of time. You remember, in fact, I remember calling, this is so iconic, calling congressmen, legislators, local officials to see,
hey, could you get us masks? We thought we had enough masks, but they got gobbled up very quickly. Before you know, we had a bit of a crisis. I got 5 other communities together to co-bundle a order of masks. We're very excited about it. We found a manufacturer who could do it for us because it was a huge order. The mask got to the dock. We heard it got to the dock. Guess what happened? If you can believe this, it got confiscated by the federal government. It went into the inner city of New York. Between the no calls I got from the legislators and the confiscation of the masks, which would have helped save lives, I thought to myself, we are on our own, and we better figure it out. We better figure it out. You might say, what does that have to do with philanthropy? Well, you know, as you kind of trail through the story, it's about the solutions you come up with and how you have to be very creative. And I'll tell you just one quick story. So when these things got confiscated, I thought, oh, my blankety blank, what are we going to do here? So I sat down with Patty, I said, you know, I don't know, you know a lot of people all over the world. Do you know anybody who knows anything about masks anywhere in the world? I said, I do actually. There's a guy from Dublin, and this is the craziest story, and this story stays here. Are we all good here? Okay. He has a plant where he manufactures whiskey, which ironically was at the epicenter of COVID in China, and I think there's a mask plant right there. I'm like, are you kidding me? Yeah, there is. Let's give this guy a call. So we call his friend in Dublin, okay? We say, and his name is?
Jonathan.
Jonathan, hi. You know, good friend of Patty's, have a question for you. Is there any way you think you can get us some masks? There's masks next to your plant. Well, I don't know, I think I can. But I have a request. One, you're going to have to put them in whiskey boxes, number one. And number two, you're going to have to ship them to a residential address, because anything that said senior living on it would have got confiscated, if you can believe that. So I thought we'd be lucky to get these masks in, 6 or 7 weeks. And we've got 20,000 masks in about 2.5 weeks. And yes, we do order that whiskey on a go-for-it basis. We are very thankful. But my point is, there are moments where you got to get outside the box. But we shared that story amongst many, many stories, and we'll forward to the next slide. The things we did, to honor our staff and so forth. And you've been there, you've seen that. But even if you take the next slide, because there was this black cloud over senior living, so not only were we getting masks, however we got those, and oh, by the way, when the local village officials, called me and said, do you have any masks you can loan our police officers and our firemen? I thought, oh my God, And by the way, the other question I asked was, if we ever had any trouble, we have a panic button there in minutes, how quick could you come to respond to our community? Now we're on the outskirts of Chicago, they said, it would take between 20 and 25 minutes, and we just want you to know that. And they're only like 3 blocks away. What were they telling me? They all have COVID. They were sick, okay? And it was one of those times. So we're like, okay, we really, really got to figure this out. So what we did is we invested in technology. We invested in what's called bipolar ionization, and actually it's an old technology with us through static electricity. It scrubs the air and it pulls in the virus and the bacteria. Okay, so it's been around for a while. So all of our air handling units, we put that on. You've heard of AccuShield. But then what we also did, we went with an infrared system where we could process 300 employees within an hour coming through the employee entrance. By the infrared, you go into a camera, it would pick you up within seconds, and then log your face. Yes, we did follow the HIPAA rules, and it would be documented in the computer. So those things we had to do in order to support the workers, keep us safe, and do all these things. Matter of fact, the next slide, I think is our, this is a robot, if you will. So, and by the way, I'm going to tell you, all the technology we purchased, we shared that strategy with the residents. Guess who paid for that? The residents. The residents. And this is a infrared, or I'm sorry,
2D.
I'm sorry?
2D.
2D, yeah, but it's a blue light cleaning process. They use this in OR rooms, at the local hospitals, so you'll see these quite a bit. So once you clean an area, you then put this machine in there,
and it talks and it does all kinds of things, but it really does the final sanitation of the room. And what that is, while it does that, what is that? What is that? What that means to me, if I was a senior, would be that I have a chance of living, you know, and you're trying to keep me safe. And this thing was very, very expensive. Again, something else the residents paid for. My point being, you know, you got to think through the things that are important to the people we serve, our customers, if you will, our residents, and how we might serve and help them. Because them feeling safe was extremely important, which began that whole philanthropic strategy, which kind of boosted us down the path.
I would just say there then as well, and this is probably why it's so important. Our own experience has been that Jay has been really on the front line, communicating the message with the board, bringing the board with us. We're in the back end working with residents, meeting them, getting a sense of what they like, what they don't like, reviewing the records, and then trying to match. Like when we look at the Trudy, we look at the bipolar air, we didn't just say, hey, we're looking for someone we're going to sponsor. We made targeted asks, you know, that we said, okay, this is the person we want to talk to. We communicated the message in a broader way as well through fireside chats, and we'll get to that in a minute. But the point really is that, you know, you're articulating the message, you're making a compelling argument, and you're bringing donors with you, people that probably were saying, you know, I live in a pretty nice place, you know, but now I'm actually going to make that extra step on top of my monthly assessment to make that gift. And why are they giving? Okay, there's a pandemic that's going on, but ultimately, people give to people first, then the organization. So it's having a strong leader who embraces the mission, who embraces the power of philanthropy. And on the flip side, it's giving donors an opportunity to be part of the process in this. So we've been, you know, keeping to our guns and bringing people on that journey.
As we move to the next slide, Patty's going to go over kind of the process. And it truly is a process, it's a journey, it's taken some time. But you all recall, for those who are in senior living, do you remember all the negative press we had? It was just really unfortunate. So we thought, okay, how can we undo that? And so we began to write articles about technology and being preventative and being thoughtful, and we provide meals to our employees once a week. You know, things we've given away and so forth, and try to get some positive press, you know, versus, well, you had 2 deaths, you know, if you're going to die, you go ahead and go to senior living, and that's the place to doomsville, if you will. And it's kind of fascinating. We even talked to one of the congressmen, who's been on TV quite a bit, by the way, and I'm not going to mention his name. He happened to come to the community a couple times, and I said, please let us talk to, you know, congressmen and legislators about if this happens again, and here we are with multiple variants, you know, there might be ways where we can think through how the monies might be redirected, if you will. Because really where the trouble was in senior living, it wasn't in necessarily hospitals. And somehow hospitals were the heroes, and senior living was what? The chumps, you know. And that, I don't mean that in a critical sense. Of course hospitals need funds, but it was kind of interesting. But, so that was kind of the basis, which then we began these processes. So Patty, you want to go through those?
Yeah, certainly, you know, even in terms of IDPH regulations, we had to give regular updates, particularly with COVID protocol. And initially, people were kind of wondering, but I think it really engendered a sense of real trust. We had a good leadership team, knew what they were doing. They were with us every step of the way. Town hall meetings, and the town hall meetings that we have once a month, that's a great forum that people can get a philanthropy update, as well as the systems and operations. Bear in mind, my big job is to always look at the budget, always see where the need is first. If I can get a donor to give to the budget, that's a great thing. If they want to give to something else and we actually need it, then that's, you know, we'd be happy to take that on. Our monthly newsletter updates, and then we began to realize, okay, we got this, remember the wall I talked about? We said, okay, well, what's really synonymous with Plymouth? And every year we don't do events. I don't believe in events. There's no money in events, to be frank. But we do one annual donor appreciation event. It's called a legacy tea. And then we bring everyone together and we just put on something so beautiful that tells the story. People are honored. It's like a club within a club, if that's the right way to put it. And we release butterflies because Plymouth is synonymous with butterflies. I never knew it. In fact, I never really had such an appreciation for butterflies until when I was releasing a butterfly one day. I actually stepped on one and it kind of didn't work out too well. But that was okay, it's another story. So we decided to say, well, how about if we launch a magazine called Monarch to tell our story? Monarch magazine. And it's interesting, we produced this in-house. Jay will give these out here. To date, we've done, I think we've done like 7 publications. It comes out biannually. We oversee everything. We do the interviews, we do the publication, we do everything in-house. And I must say, we've had such great reports from everyone. We have families who tell us, send it to their sons and daughters all over America. Many of them are being solicited all the time, and they look forward to our story. It's kind of folksy, you know, there's a little bit of plan giving, we gently put it in, but we're slowly building this up to just tell our story, but from different sides of the equation. And this one actually tells the story of Marion Giles, of course, 106. It's a wonderful life. It is a wonderful life at Plymouth Place.
There's our cover girl. There she is. And by the way, this was a great honor for her to be on the front. I think we have the video, Patty, we're going to
So we're just going to, what I'm going to do here as we organised it in April, fireside chats. So as we bring up to our annual fund, we get everyone an opportunity to spend time with Jay. Because as you can tell, he's a great salesman. So we want to make sure everyone gets to spend time with Jay, and then we build them up to the annual fund that always comes out in May. 90% of our gifts come from people in-house that live at Plymouth. That's incredible. We created a new dedicated website on plan giving that talks about the instruments. My background's in social work. I have a knowledge of the different gifts, you know, charitable gift annuities, charitable remainder trusts. But we want to make the case to get with them, to be with their financial planner, and then we can work the rest out. And then, of course, video testimonials. And this is a video that we're going to show you here now.
As we pull this up, how many people have seen Apollo 13? Okay, this gentleman was in Cape Canaveral. He was there guiding Apollo 13 home, one of our residents, the first physician astronaut in space. He has a testimony once a guy, Plymouth Place resident.
5, 4, 3, engine sequence start. 2, 1.
Dr. Joseph Kerwin.
3 astronauts, Pete Conrad, Dr. Joseph Kerwin, Paul Weitz, have arrived on the scene 270 miles above the Earth.
Well, way back when I was a kid, I read science fiction, and this was science fiction from before there was any science to it. In other words, no space travel. It was all made up. I got a letter in the mail from the United States Navy saying, congratulations, you have been drafted in the doctor's draft, and went down to Florida, and the rest is history. I just loved it. I loved flying. My wife pinned on my wings. By the way, I met her at Passivant Hospital in Chicago. And NASA, which had gotten started by then, is looking to hire scientist astronauts to go to the moon. And Lee looked at me and said, you probably want to do that. I said, I'm not a scientist. But yeah, I wanted to do it. NASA wanted 75 candidates, but all they got was 15 people, and I was one of them. Family life down there in Houston. I didn't truly realize how much she gave up to let me fly around the country and be an astronaut and do all these, things, while she kept the home together, raised the kids properly. When her health began to deteriorate, it got to the point where we couldn't care for her at home. The care here was so much better than any of the other places that we had seen. It was almost magical. It was management. The place is well managed. It gave Lee almost 2 more years life, which I had a lot of pleasant times in. I love it here. I've got friends I didn't have before. Who knows what the future holds?
What an amazing story, and we certainly take great pride in sharing the accomplishments of Dr. Kerwin, who not only entrusted us with the care of his wife, Lee, but lived with us so he could honor all she had given up for him. If you think about it, that's what life's about. It's about sacrifice, remaining steadfast to what we know and love, while having the courage to blaze a new trail. Thinking about it further, that's what sums up Plymouth Place. We're continually investing in the future, outpacing needs with new technology, expanding our horizons. It's no small feat, and it takes all of us coming together to make it possible. You'll see that in the next story about Betty Norton.
My mother was a flight attendant for United Airlines, transporting servicemen to various places. She was captain of the women's golf team, had lots of really good golfing friends, and just loved the game. My mom lived here for more than 7 years. I've always found the staff here to be very warm-hearted and very considerate, very caring. They're not just skilled at what they do, they're highly skilled in their ability to care for the residents, but they're also just very compassionate and very genuine. The reason my mom did so well here is because she got such warm-hearted encouragement from people like that, and she connected with them personally. They loved my mom, and she loved them. When I compare Plymouth Place from the day my mom moved in to today, I see exponential growth in the place, the grounds and the property and the building itself, but also in the way the place is run and the things that are offered to the residents. There's always a place for you here, no matter what your needs are. I can't imagine a better experience for my mom in those last 7 years of her life. I refer to those as the best years of her life, thanks to Plymouth Place. And so I'm happy to support this great organization.
So as you can see, at Plymouth, we are trailblazers, every one of us, whether we're just embarking in a new career or pushing the envelope in unexpected ways, like the Arboretum Villas. Everyone counts, every moment matters. And although outer space is way out there, maybe way outside of our wheelhouse, this is the space of honor, where we can offer seniors exactly what they need and when they need it. And you know, we take tremendous pride in that. This is your life, our legacy.
Okay, we did that about a year ago. So what's that about? That whole story. First of all, I mean, for me, we made it, so it's pretty moving, But what is that? What is that? What are we doing?
About people.
About people. We're telling our story. And by the way, so the shift is, it once was, when I got there, we're needy. No, we're meeting needs. We're focused on excellence. And we're focused on relationships. And here we go. We're trying to help you complete your story, and have you live the rest of your life, vivaciously, vicariously, and the story's yet to be written. And so in the end, the elevator speech is, we're here because we want to make a difference in the changed lives of people, whether it be employees or whether it be residents. That particular film by the way became pretty iconic. Now, mind you, this guy's a very popular guy, right? He was the first scientist in space. And by the way, the Space Lab program he developed, okay? And he goes on to tell another story where when he was in the Air Force, he was in Florida, and one of his generals came up to him and said, and all the people were at a bar, very interesting. This goes back in the 60s. Who's been around in the 60s? Okay, you'll remember this stuff. So the general came in and says, I need someone to fly this very important document up to Washington, D.C., and they're going to be accompanied by the CIA. Okay? And he said, Kerwin, looks like you've not been drinking. Get on the plane. You're going to go there. I mean, this is how it happened. So he carried this very important document to Washington, D.C. CIA assisted him. He personally handed it to the president. And you know what that was? It was the pictures of the missiles in Cuba, the Bay of Pigs. Okay, so my point is, even your story may not be that big, but every resident has a story. You have a story, but you got to get to those stories and then tell your story and about passion, about service, and about excellence. And then people are usually like, you know, I want to be a part of that, you know, because it feels like winning, you know. So anyway, that was the big shift over the past 5 years. And that video wasn't really that expensive to produce.
Did you produce it?
We had a local group called Dick and Doris do it. And they did it, by the way, off of an iPhone.
Did
So,
they really?
Yeah, yeah. No, they you know, patched it in and everything, but they did a masterful job. So, yeah. Eddie?
Yeah, and I would just, you know, pick up on what Jay is saying, you know, communicating the message with pride and passion. If there's one thing that I feel donors really want to see is tangible benefits of how their money is making an impact. So everything that we're doing here, in some respects, there's healthcare philanthropy. It's not just, you know, senior living in that type of sense. It's healthcare philanthropy. See how we're saving lives, we're making a difference, we're investing in new technology, and also the scholarship program is really like a university model of fundraising. So for us to be on the cusp of working with donors like that, that's a huge opportunity. In fact, what Jay did last year, which is just phenomenal, we've been able to bring in 20 nurses from the Philippines. So to be able to tell that story of how we're able to work with and have those structures in place, that's an amazing message to communicate to donors. They want to see that happening and they want to get behind it. So we communicate with the board. We have an emeriti board that we work with, maybe like 10 or 12. When I first arrived, I thought there was 3 or 4, and then more start mushrooming out, and we're just, they're your plan give prospects. They're your people you really want to keep close with because, you know, they know it so well. People, consumers, everyone that comes in, everyone technically that comes through the door of Plymouth Place, I want to know. If they turn up at a Rolls Royce, I really want to know. You know? But the point is this, is, you know, we're all the time assessing, we're making that connection. What's the connection? Assess the ability to get involved and then involve them. And when we get them involved, we get to know them more, give them a job, volunteer, something like that. Really empower them. They believe in the mission of Plymouth, and then slowly they're part of our donor societies, and we can work with them more. So knowing your donors, I mean, as Jay said, the Dr. Kerwin story, the guy's amazing. There are so many amazing individuals. I feel so privileged to be with people at their greatest time, at their hardest time. The work of our chaplains is phenomenal. I think they get the sense really that this is their home. They want the best for their home, and they want their children to know this home that they're part of. And that's kind of where the monarch came about. It wasn't just the butterfly, it's that it actually takes, and I didn't know this, it takes 5 generations of monarchs to make the trek from New Mexico to Illinois. So if you think about family philanthropy like that, and the makeup of some of the people at Plymouth Place, we have one person, she's here, her mom was at Plymouth Place, she's here, and now her daughter is actually saying, I'm going to be moving in, I'm saving up. 3 generations of families that we're working with. And back in the 70s, her mom, her grandmother actually, benefited from our benevolent support fund. So this is all amazing information that as we build case proposals, we can work with that and say, can we work with our CEO or who are the best people to make concrete proposals to ask? Because you have to ask. I mean, that's what it's about. So again, looking at solid fundraising systems, I would say having a very planned out calendar, a year out. We usually set our calendar maybe by December, knowing what we're doing for the exact year, right through. There might be a few things that will pop up, but we're very focused on that. Where are the major gift opportunities? Where's the budgets coming in? Who are the key people that we can connect them with? And then we have a system, what's known as a moves management process that we work with we meet now every 2 weeks.
We're going to...
So I'm going to hand you over to Jay now.
Yep.
So, prior to 2020, we embarked on expanding the community. Our current building is 16 years old. Even though we've been around now for 79 years, the building over here is the existing building. You can see kind of an age. But this was planned for some time, but we just couldn't get there historically. And so through really a number of strategies and application of those strategies and hard work and leadership change, we now have launched what's called the Evergreen Villas. It's almost 2/3 done. I won't get into too much detail, but the average age in independent living is actually 86. The average age out here is 72. Isn't that amazing? So these are the children, the adult children in independent living. You know, so it's pretty amazing. And at first, I will tell you, our residents in the main building, now this is as we go on all through the philanthropic piece, were very nervous about that because they thought they were going to end up paying for that. And is it going to jack up my monthly service fees and so forth? And I won't get too much into that. But again, through a series of communications over 2 years, 2 years, what has happened is we've had 4 donors in the past 3 weeks give a total of over $1 million for this. All right, and that's amazing. It's amazing. And this area here is going to be interesting. This is a Center for Healthy Living. We help our 5th independent living restaurant and aquatics and areas outside for Tai Chi and dance and so forth. And a greenhouse and pickleball, bocce ball, and lots of green space. So, you know, is it about that? No, but it's about honoring people, you know, with regards to their life, because it's their home and we're the guest. These are just some more pictures. This is one of the outdoor venues right outside of our bistro and also our main dining area. It's called Dixon Gardens. Significant donor, by the way, who has given over $400,000 for this garden. That actually, believe it or not, is the rooftop of a 1-story parking lot. Isn't that great? That's what it's going to look like. And maximizing all the green space. So, Patty, I think you're going to wrap up with a couple of things.
Just a few more. So, yeah, we did engage in an outside consultant just to get it. We've never done this before. Get a sense of who we're a small shop. What are we doing right? What are we doing wrong? Feasibility study towards a capital campaign. And the word capital campaign alone, some of the board are like, what are we doing? Again, it goes back to why give to Plymouth? We're doing pretty good. So we're just trying to work with them around this mind shift. And the Moose management, again, it's all about getting people in the one room to say, where are the opportunities, celebrate the successes, and tell the board to get them part of it. And I think the last couple of years has been good, but I think the real successes with a couple of major people that have stepped up to fund some of these bigger opportunities. It's like, is that $100 million development? So that's a pretty big, you know, commitment for a standalone community to take this on, and we're doing it. So I always say fundraising is the right person asking the right prospect for the right gift, for the right program, at the right time, in the right way. So in an ever-changing donor landscape, yes, I like to think that donors want to see what they're giving to. I think they all do. It's not just the institutional donor, the faithful donor that said, you know, I'm going to put you in my will. They really want to see it. But it's the art and the science. There's the science and the solid fundraising systems that you can put in, make sure that you keep on track, and then working it through, having great communication with your CEO, board members, and your senior leadership to make sure, is everything being touched? Is this proposal that we're about to present, does this sound concrete proof? So these are some of the results. Just in terms of our scholarships, since 2020, we've given out close to 282,000 in scholarships. If you're a full-time person, you can get $8,000 a year.
Yeah, if you're an RN, you can get $10,000 a year scholarship if you want to advance. And then if you're a full-time person, you could be a CNA, support service, food service worker, $7,800. Yeah. Now, you have to apply multiple times through the year. And by the way, you may be sitting here and say, well, we don't have that kind of money. We didn't either. Again, it was, you know, building these relationships and these connections with key people with real passion. And the person who gave us money I think she gave like $5 every year. You know, so you have to kind of peel back the onion and find out, well, who are these people? Who are, and you know, what's their story? So this is just in terms of our annual fund. So when we first arrived, it was probably about 25 people giving
significant gifts. Of course, with COVID, we had a huge bump, but we've been able to maintain it consistently year over year. We're able to have about between 145 and 150 individual donors that give $1,000 or more. That's pretty good. Of those, 46 of those give 5,000 or up. And in planned gifts, we initially were able to identify 5 planned gifts that we knew of. To date, we now have 23 confirmed. So you can see, not only are people, they're volunteers, they give annually, and then they put you in their estate. And it's almost like the nature nurture. You know, if you're going to ask a male for a gift, you'll say, hey, will you give me 5,000? They'll either say yes or no. For women, it's different. Many of them get involved in volunteering. It's the nature nurture. They get a sense of, are the right systems in place, out of which they'll end up making a major gift. And that's, you know, definitely something that we're very conscious of as we analyze the data and we understand who our donors are, where do they fit into the annual fund. And it's very important for us to not just keep focused on those that give 1,000 or up, it's those that give the $10 every year or more. They present some of the most amazing transformational gifts, so we're very focused on each of them. How do we do it? Many different types of ways. If you have a special birthday, we celebrate birthdays. We have a whole system in place where we'll turn up outside your door, we'll sing happy birthday, Jay will sing happy birthday, I'll sing happy birthday. We wow people, and we love it. It's just such a joy to do it. If you like doing what you do, the rest will follow. So these are just some of the numbers that we're working with here. This Dole Trust is significant because Mrs. Dole, if you go back to plan giving, here was a lady back in 1948. She put a provision in a trust called the Dole Trust. Mrs. Dole and Andrew Dole, they had a lot of patents, no kids. They were members of First Congregational Church in LaGrange, and she put in her trust maybe about 21 not-for-profits at the time. It's now about 6. The first gift came through 26th of May 1950 for about $20,000. Every month since then, the 26th of every month, Plymouth Place receives $26,000 into the bank, as well as the other not-for-profits. Today, that's about, I think it's something like 8 million. Isn't that amazing? So we're only servants of a greater good here. When you go back to the Elvira Toyfer, who wouldn't go on the world tour, she kind of kept that money to pass it on. And we're just grateful stewards of people's belief in our mission. And our mission was reevaluated when you think about COVID. Who we are, what are we about? We're not just senior living. In fact, we're taking away that term senior living. We're exemplary living across generations, as we work with all generations. We want to make an impact, and we're bringing people on that journey.
Just the reason why we told you about the technology and the efforts and all those things we did during COVID, you can see what the impetus was, right? So what was the turning point? 2020? Yeah. So, I mean, I'm going to say this, but COVID was really a blessing. And so making lemonade out of lemons, and you're going to have those situations or speed bumps you're going to hit or brick walls and so forth. But the key was maintaining it. And so then the focus on, it was keep you safe, focused on technology. Can you partner with us? We believe in excellence. We believe in taking care of others. Help us take care of our employees, and the message just kept coming. And then the town hall meetings and the twice a month magazines and town hall meetings and so forth to keep that momentum going. It's not easy, but if you love to kind of collaborate with people, you can do it, but you really got to put your plan together. And then celebrate success. By the way, I will tell you right now, our board was, say skeptical, that wasn't the word, but we didn't have a task force at the board level. It was all down here. We thought, fine, we'll get the results, we'll demonstrate that they all need to get on board. They think their role was mainly operational, okay? I mean, forgive me, I'm about to say this. I don't need the board to tell me what to do operationally. Well, we'll kind of figure that out. What I needed to do is help me figure out who might be that philanthropic donor
who might be that person you can come say thank you with? Now, their nervousness is, you look at Plymouth Place, you see the building, it looks like Taj Mahal. Looks like we're dripping with money. Guess what? We break even. We make money on the top line, 7%, it all goes to pay for the mortgage and all the other expenses. We truly break even. So that's why, we're not talking about, needy, because a lot of people won't give to rich senior citizens, because that's not the message. But excellence. Why do people give to Mayo Clinic? Now, we're not the Mayo Clinic, but they have millions, almost billions of dollars in their foundation. So why do people give? Why? Excellence, it stands for something. So when you're reinventing senior living and you've got people believing and you got to keep fanning the flames of goodness, it's important. But the key was leveraging, that. I think we're wrapping up because we're going to do some Q&As. And I think we need to leave 1 minute at the end to have this gentleman sing. What do you think? Do you like that?
Yeah.
Okay, good.
I would just say there as well, just building on what Jay said, in my former company, working with Lutheran Life, I was very much involved in an organization called St. Paul's House in Chicago. It was traditionally run by UCC, St. Paul's Church. And over years, they weren't able to keep it going. The Lutherans got involved. After I'd left, they had actually sold it, and it was sold for profit. It's one of the most beautiful organizations. I could recite verbatim how St. Paul's House came about through Pastor John, 1906. And that's heartbreaking because, we work with people over time. When you sit with people, your word is your bond. And it wasn't the Lutherans' fault that they had to pass it on. They were they couldn't get any more bonds, And so the lesson for me is that probably St. Paul's House 10 years before that needed to invest in Plymouth Place. It needed to invest in St. Paul's House. That's why we're investing here, because we want to make sure that this survives. And donors and planned gifts, donor prospects, they want to know that the institution is going to survive. So all of these are very subtle messages as we bring people forward. This is our new donor wall. So we transformed it from the giving tree to now this is our annual giving circle, the Naomi Borwell Giving Societies. Our annual givers are here. Our loyal donors, people that give 5 years consistently, is here. This is our Plymouth Rock Society, people who tell us that you're in our estate, we give them a rock. And as somebody said to me once, well, I prefer to be remembered as a butterfly than a rock, so that's kind of good. And then, what we did, learning from that initial person that, forgot to give, but gave an estate gift elsewhere, we came up with the Monarch Society. So if you give cumulatively 100,000 or more, you get a butterfly. So we were able to run the numbers from the previous tree and found that there were 42 people that gave 100,000 or more. That's a very compelling story. And we've been able to add, since then, actually we're going to put on another 4 next month onto that. So you can see how we're building the continuum, we're telling our story, we're bringing people with us. And I would say that, this has to be, personally, and I think really as an organization, this is a real calling to be a force of positive difference in our greater society, and donors want to see that. And I would finish with a little song. If people would say, what would be your song? You all should have a song. Everyone should have a song. I would probably think of this particular song called If I Can Help Somebody. You know that? You might sing it with me, if I can remember it. If I can help somebody as I pass along, if I can do my duty with a word or song, if I can spread love's message as the Master taught, then my living shall not be in vain. Then my living shall not be in vain. Then my then my living shall not be in vain. So by the way, we're really into the personal stuff, so we like to bring people to Ireland. We're taking people to Ireland in September, and it's interesting. We bring our donors, prospects. We brought people to Ireland last year. I'd say about 5 to 7 of those people that came to Ireland ended up making major gifts because they got to spend time with you.
Well, and yourself. So, well, that's just a small part of our story. So, I know you only have about 5 minutes, but 2 things. One, you can certainly call us if you have some more questions, because we really want you to do well. Nonprofits do great work, but they need people around them who give and donate and partner with you so we can do greater work, right? Is that true? Right. Questions? Yeah, anything you want to comment on? Or everything we told you?
Can you talk a little about like your board policy around giving, like your expectation, and then also equipping them in a way that they can be ambassadors?
Yes. So I think we had to have proof in the pudding and get there. And me being the coach saying, and earning that credibility. Let's focus less on operations and more on philanthropic efforts. A. B. Took me a while, but I said, look, we need a task force at the board level. Now we have, really as of a couple weeks ago, 4. And the process by which we're going to engage them on the front end is just to come and say thank you. But when they see these kinds of things, they get excited, especially when 4 individuals give over $1 million to a campaign, to a building that they may not live to enjoy. So our board is on top of things. They get a little nervous about compliance to make sure every I is dotted and T is crossed. We do have donor perfect, so we know where everything goes, whether it's restricted or unrestricted, and the immediacy of the letters and follow through and documentation. But we have all that kind of in place. So I think we're beyond their concern or jitteriness, if you will. And maybe slowly we'll get over the fact that, we don't want to ask the board, our friends, to give money to a place that's perceived as very wealthy. That's the biggest, bugaboo.
I would just add to it as well that we really have to have a culture of philanthropy. So
Right.
I can't sit down there and ask someone for a sign given myself.
Right.
And everyone on the board is expected to give.
Right.
Every senior leader is expected to give. We have an employee giving program, but it's more about a hardship fund. But the board has to be part of it. It's a process there.
What you might be leaning into is that do we require a certain amount from the board? We don't, because we're not there yet. They think, well, we give our time, so we're going to give you money. So board members may give between 500 to maybe as much as 10 or 15. We're okay with that. We're just thankful, But I do think, we want to set. So if I'm going to give, I don't want to be up on the board because, hey, look at me, but I want to set the tone, set the example. I want to be that. So we expect every senior leader and every board member to give. And, there's been a little push and pull on that, but we're getting there. But, when you look at the results, you got to begin to wonder, wow, how can I be a part of that? When you're winning, so to speak, that feels good. And the board does want to be a part of that. How many people struggle with it being an operational board versus a philanthropic board? Is that something?
We
Yeah.
kind of walk the balance. And,
Yeah. I heard this thing, it was 5 years ago, and it dawned on me. The guy said, look, boards, God love the boards, but they need to be 70% philanthropic, 30% operations. And we were just reverse.
Yeah.
In fact, we were like 10% philanthropic, 90%. But we had to get some things right. We had to work on some things. But they are supportive, gracious men and women. They work very hard, and so we're thankful for that. And we celebrate, by the way. We want them to celebrate with us, because when you're celebrating and interacting with presidents, you hear these stories of Dr. Joe Kerwin. How can it not move you? And by the way, Mike Naughton, who talked about his mom, who is the United Airline pilot. Okay, here he is. He's 68. He's moving into the Arborwood Villas from California. Isn't that amazing? So success breeds success.
And I would say a major donor, and
Major
also
donor.
is an editor with Schwab Charitable, and
Yeah.
he's now going to come on as one of our editors for Monarch.
Yeah.
So as we're working things
So-
through, we
Yes.
involve, we
Yeah.
impart, keep them as
Yeah.
close to us as possible.
The ask is a kind of a weird thing, right? But I think as you build a bridge, you have to earn the right to ask. But at some point, you have to ask. And look, we make mistakes all the time. You know, we make mistakes. So we learn from those, yeah.
I always wonder about researching donor prospects.
Yes.
What are kind of the key things to
Yeah.
look for, you know, just randomly Googling somebody isn't
Yeah.
going to be
Yeah, I would
most
say there
effective, but
that-
what are
yeah.
the things?
We hired a company
look
called
for.
TWB for that very reason, because, I mean, we've got to do, we don't want to do shotgun approach, we want to do
Right.
rifle shot approaches.
Yeah.
So we hired TWB, and Patty can finish the story, but we know some of the top donors. Now remember, most of our donors on the inside, and also we raised the corporate bar. We have corporate donors now,
Right.
which are significant.
I would
We
say
hadn't had
there
that
that,
before.
you know, we have donor search that we work with, you know, gives you an idea, but ultimately, it's like, we're in a very privileged position. I mean, we spend so much time with our donors.
Right.
We
Yeah.
get to know
That is
them in very intimate ways.
That's a
We
really
get to know
good
their
step.
stories, their likes, their life, you know. It's, when I look at some of the donor search data,
Mhm.
in comparison to the giving of some of my donors, it doesn't add up. Some are like a DS1, where some is a DS5, I'm like, no, these, so it gives you an idea, but it doesn't fully get you there, you know.
I would though, you may want to, it's up to you, get some consultant help, and we could pass along, you know, we spend a ton of money on that.
Yeah.
But if your focus is on the outside versus internal, it may be, you may get some help with that, because if you're swimming in a sea of a lot of stuff, you
Yeah.
know, so,
Yeah. And, you know, we have a half-time marketing communications
Yeah.
person and me, and, you know, our staff for really targeting donors and dedicating that kind of time and energy
yeah, right.
isn't there. But it could be someday if we knew who to reach
Yeah.
out to first and really cultivate.
And I would say having the value of like a philanthropy team
Mhm.
that you can come in and train
Mhm.
to see, you know, I always say, who'll give you five? Give me five
Yeah.
people that you think you could talk to.
Yeah.
Start from there and build out.
Outside of families, compassionate people, employees, leaders, mainly, and board members and residents, we haven't cracked the code on the outside yet.
Okay.
Actually, we were very, very close with a multi-billionaire, and I can't get into it, it's very confidential. Sadly, he died of a brain aneurysm, and things went a whole different way, and he's very well known in Chicago, and we had some inroads, but you know, that happens, and but what we get kind of like, you know, the individual who gave, you know, $1,600 over her lifetime, but then she turned around and gave $16 million to a foundation. Now, we weren't there at the time, but again, it's about, I don't know if she knew the story, heard the story, these stories, you know, and so had, you know, she lived it a little longer, it might have been a little different, but that's okay. God blesses you in other ways, and you know, you move from that. Other question? Somebody else had a question?
It's not a question, it's a comment. I mean, I'm looking forward to somebody, whether it's Pew or somebody, doing research down the line about the impact on charitable giving of the pandemic.
Yeah.
Because anecdotally, you hear all sorts of nonprofits, including my own, tell the story that you told about the big
Yeah.
jump in giving. And I'm convinced where I am that it's because it was in the crisis that people suddenly realized the value of your organization to
Exactly.
their lives.
Yes.
Yeah, you
Right?
saw that.
Yes.
Yeah, I mean, that
Yeah.
was very
Very
vivid.
much.
But
Yeah.
then the question is, can we, all of us, can we maintain that? And can we continue to show them
That's it.
evidence that we
Yeah.
still have value in their lives even when the crisis is over?
Yeah.
Yeah.
That's why, to that great point, that was a question of board members. That's why, Patty, go the other way. Well, the slide, yeah, second to last one. You could see where the giving's been right about 800,000, but maintaining it meant even then, okay, now we got to kind of fast forward some of the things we're doing.
Right.
Yeah, so, yeah. And by the way, what I will tell you, not only do our residents get the scholarships and here, but they gather a pool of money, about $240,000 in each full-time employee last year got a check for Christmas time, $1,400. Okay, now what is that? Because, you know, our residents do have resources, but they're very gracious, but they have this symbiotic relationship with their employees, you know, and they really, really care about our employees. We have a very diverse workforce. Not so much at the resident end, that's changing, but
I would
it's
say
pretty
there as
interesting.
well, got to keep hammering home your story. You gotta keep coming up with it, you gotta keep with the calendar,
Yeah.
you know, and you gotta get the face-to-face, tell them what's going on, and actually knowing all their birthdays, anniversaries, you know, it's not just about having a conversation, it's
Different
knowing.
setting.
Well, it's not,
But just for me,
it's
it's
saying,
you know,
there's a canyon difference between friendly and friends,
yeah.
you know?
Yeah.
And again, to be honest, there are some residents we don't have a discussion with because we know just from a maybe mental health standpoint, we don't want to, you know, violate anything. But if you notice, to your point, so when the board saw this consistency, they're like, okay, something must be happening. And look, we realize it can go down, but we got to keep up in the ante. And I just can't say enough about meeting people, knowing who they are, knowing their story, and communicating and developing these relationships.
And I would say as well, just go back to Mrs. Dole. I mean, she set that trust up in 1948, and here we are today still benefiting from it. Where are the other Mrs. Doles out there today? You know, and I look at the plan giving pipeline that we've created. You know, for every plan gift you know, there's another 3 out there that you may not know of. So you have to try and capitalize on that, find those people. So I think that's where the real opportunity for COVID will come through, because some people have said, I'll never forget, we have one lady who was given annually, and I'm probably going to make a big gift, and she says, you saved my life. You know, if that isn't a planned gift opportunity, I mean, I don't know what is, you know.
Right.
So, yeah.
We have more of these if you want.
Thank you.
Thank you.